21st Century Business.
Welcome to 21st Century Health. I'm Jackie Bales. Negative pressure wound therapy, or NPWT, is a treatment that applies negative atmospheric pressure onto a wound through a pump, sucking out the drainage. Historically, it's been extremely painful and extremely costly. Joining us to discuss a remarkable innovation that helps solve both of those issues is Cindy Ahern, Director of Clinical Services for Prospera. Welcome, Cindy.
Thank you, Jackie. Pleasure to be here.
Also joining us is Professor and Medical Dr. Malin Malmsjö of Lund University in Sweden. Welcome to you too, Dr. Malmsjö.
Thank you so much.
First of all, Dr. Malmsjö, can you elaborate on the difficulties that are seen with the traditional NPWT treatment?
Well, first of all, I would like to take the opportunity to say that negative pressure therapy has really revolutionized wound care during the last little more than a decade that it's been around. However, now we're realizing that there are problems with the therapy. And those problems we're trying to address by doing research, getting back to science, and figuring out how does the therapy work, how can we improve it. And in our hands now are 2 letters from FDA, which are warning letters for complications during negative pressure therapy. And it's mainly about pain during the treatment, pain during dressing changes, and ranges all the way up to bleeding complications from exposed organs. And when, for example, applied over the heart, you can get a heart rupture and the patient can die. And this is what we want to address to optimize the therapy.
Cindy, tell me about Prospera and what Prospera has developed that is so revolutionary.
Prospera entered the market and challenged the conventional thinking. Conventional negative pressure therapy has been offered over the last 10 or 12 years only one way, and that was a continuous therapy at negative 125 millimeters of mercury pressure. And there were some complications that go along with that Dr. Malmsjö related to. And what we found was that as we began to look at the research that supported that conventional therapy, there were a lot of weaknesses in that. So we immediately recognized that we needed to go back and do some controlled scientific studies with wound fillers side by side. And we recognized pressure and wound fillers and mode. And the scientific data that was behind those mechanisms helped us design the Prospera Pro series of pumps. And those pumps are what we are able to take to the patient and improve their quality of life as well as their outcomes.
Well, conquering the issues of pain and complications seems like a desperately needed improvement. So let's see Prospera's innovation in action in this 21st Century Health Field Report.
Chronic wounds have long been the result of poor blood circulation, most often seen in patients with diabetes and those who have been bedridden for any prolonged period of time. Negative pressure wound therapy, or NPWT, works in a number of ways to promote the healing of acute chronic wounds. Until now, previous NPWT treatment has been reported as being both expensive and painful. Prospera has the solution.
Patients at first are a little skeptical because they're used to just sponge wound fillers. Once they have experienced the ease of application of the gauze and see the results of the application, we find that variable pressures are a lot less painful to the patient. Plus it stimulates the wound bed and we're getting really good results.
Prospera promotes wound healing with NPWT to the next level, making it more accessible to patients and providers at a more cost-effective rate while offering positive wound healing outcomes.
The program that we've developed provides a true solution to our customers. The outcomes that we're seeing are very impressive. We're seeing healthcare systems across the country change their current way of thinking to incorporate Prospera.
Traditionally, NPWT has been unaffordable for many patients, which is reflective of narrow market competition. In other words, if a patient's insurance didn't cover it, NPWT was too expensive for most to pay for themselves. Prospera provides a solution that is reimbursed by most third-party payer plans.
The conformability of the antimicrobial gauze makes it truly superior to other choices. You're able to address any undermining, any tunneling, any open areas in a very straightforward manner, with less challenges than you would have if you were using a hydrophobic wound filler.
Prospera strives to provide chronic wound patients with all of the benefits of NPWT, minus the discomfort and costliness. Their efficient system is customized to each patient's needs, with low pressure settings that increase comfort and do away with associated high and low spikes that are typically found with other NPWT treatments. For 21st Century Health, I'm Steve Michaels reporting.
Cindy, why did Prospera enter the NPWT market when it did?
At the time we entered the market, there were only a couple devices out there that were offering negative pressure, and neither manufacturer offered the technology that we knew from our scientific research data needed to be able to be delivered to the patients. So, nor were they being cost effective. So, our entry into the market was very timely because it offered both a higher technology as well as a cost-effective approach.
Cindy, why did Prospera choose to collaborate with Dr. Malmshow in Lund, Sweden for science and development?
Well, Prospera knew that if we entered the negative pressure wound therapy market and challenged conventional therapy, and we're going to market some changes, we had better have some concrete scientific data to back that up. So we searched and found Dr. Malmshow in Sweden. She is a world leader in the negative pressure field of study, and she's done more research than anybody else has, published 50 articles or so in peer-reviewed journals, and we felt like we had went to the best.
Wow. So what were the guidelines that you used in creating the Prospera Pro series of pumps?
Our first focus was patient. It's always patient's always number one. So it was, if you think of it in kind of like a triangle, the patient is at the very top. So we wanted to improve their quality of life, reduce the amount of weeks or months it may be that they have an open wound, and reduce their pain significantly. The other part is the end user, whether it be a nurse on the floor in a facility or a physician in the operating room, or whether it's a family member or a friend trying to learn how to administer negative pressure to a loved one. We wanted it to be something relatively simple and not intimidating and complex. The other side of the triangle is the cost effectiveness. It had to be something, in order to meet these parameters, had to be feasible for a patient to be able to purchase, or regardless of what the reimbursement source was, it has to be cost effective, because not everybody has insurance. That triangle, though, has to be supported by the collaborative scientific data and the development.
So, Dr. Malmshow, how does the design and function of this pump provide an advantage to the patient?
Well, there are a couple of issues which I really enjoyed seeing, that you appreciated the science before you designed the pump. Because from the research we've done, we see that the pressure range that we want to use is different to the pumps that are available today. And also there are other features that I, as a scientist, would like to see. So first, if we go to the pressure range, traditionally, minus 125 has been the golden standard pressure for 10, 15 years. Everybody's using it for all wounds. But there is problems, because some patients have pain, and pain results from the mechanical pulling on the wound by the suction force. And it also results from the wound dressing pushing into the wound, creating a decrease in blood flow. So by reducing the level of negative pressure, we could reduce those effects. So we said, okay, what's the maximum effect in the wound? What's that pressure? And we found 80. So we could reduce the maximum pressure ever used to 80. And then we said, okay, if we had a poorly vascularized wound that is in need of further considerations, or if we have pain, what do we do then? Well, now we know we can reduce to 40. So we can reduce the level of negative pressure to 40 and still have wound healing effects, still have biological effects in the wound edge, to a little lesser extent, but we still have the effects. So now we have a few hold marks that we can use for our therapy that are based on scientifically controlled studies. That is one advantage. And there's one more advantage with this pump from a scientific point of view. And that is, there is a therapy that is called intermittent therapy. That is turning pressure on, off, which means the wound is going to contract, contract, decontract. And that is like massaging a wound, which is painful, of course.
Sounds very painful.
And also there's a problem because when you let go, there might be leakage in the dressing, and the dressing may fall off. So that's where we came up with this. We could vary the pressure, cycling it gradually from two different negative pressures, and create the same movement in the wound edge, but less painful for the patient. And also, we were so happy when we received this scientific data that the results in accelerating granulation tissue formation and wound healing are the same as for this intermittent on-off therapy. So that's another advantage with the system.
Historically, patients have required pre-medication for their dressing changes. When you're using Prospera and antimicrobial gauze as the wound filler, what we're finding is that the patients require less medication to tolerate the dressing changes. We are also seeing less traumatic wounds associated with the removal of the antimicrobial gauze.
And Dr. Momsho, what can the clinician do to reduce pain in patients during NPWT?
Well, there are different aspects of pain during negative pressure therapy. I first want to describe the pain during treatment. So during the treatment, there is a mechanical deformation of the wound edges, which is obviously painful. If we want to reduce that effect, we can use a continuous pressure. And continuous pressure will not massage the wound edge, it will just keep it constantly contracted. The other way would be to lower the level of negative pressure. And from science we know that 80 millimeters of mercury we reach maximum wound healing effects. And at 40, if people still have pain, you can reduce to 40 and still have wound healing effects.
Wow. And the traditional was 125.
Yeah, exactly, exactly. So we're saying 80-40 are two hallmarks now. If we really want to have an extra effect on our wound, we want this intermittent therapy, which to reduce pain, maybe switch to variable pressure therapy where you cycle the pressures gradually to just reduce the pain in the patients. Then I come to the other problem with pain during negative pressure therapy, and that's during dressing change. The reason why you have such pain during dressing change in negative pressure is that the newly formed tissue, the granulation tissue, grows into the wound filler. And once you tear that off, you tear off tissue, and that's painful.
Oh, sounds horrible.
That's when you use foam. If you would use gauze instead, we know from our data that there's no ingrowth into gauze. So removing gauze is less painful for the patient. So I strongly believe that you should use different wound fillers for different types of wounds, but to reduce pain, gauze is a very good alternative.
You know, by using the gauze too, Jackie, since you don't have the ingrowth, you can extend the wear time of the dressing to where you don't have to change it on the standard of every 48 hours. If normally if you use foam for longer than 48 hours, you have such significant ingrowth of the tissue that's destroyed when you remove the dressing. But when you use gauze, you don't have that ingrowth. So by extending the dressing wear time, you also improve